गुड मॉर्निंग एवरीवन, सभी को नमस्ते और प्रणाम। आज हम बात करने जा रहे हैं, टुडे विल बी स्पीकिंग ऑन जल नीति एंड सूत्र नीति। दिस इज द बेसिक और द वेरी इंपॉर्टेंट पार्ट ऑफ एनी yoga therapy. Whatever the yoga therapy you are following, asana, pranayama, mudra, bandha, all these things, before starting all these practices, we need to start with Jal Neti and Sutra Neti. And Jal Neti, Sutra Neti should be practiced when you have the excess flame and fat. As per text mentioned, Meda Srashmadhika Purvam Satkarmani Shamacharit. If you have the excess flame and fat, then only you should go for the kriyas. Kriyas means cleansing technique. Today we are going to deal with the kriya which is above your respiratory tract, meaning above your shoulders. The effect will be there above the shoulder, that is Jal Neti and Sutra Neti. By using water, if we clean our nostrils, that is called as Jal Neti, and by using the thread, if we clean our nostril, that is called as the Sutra Neti. Okay, so these two kriyas very useful for our the respiratory tract, to keep our respiratory tract very good. If you have any kind of congestions or obstruction in your air pathway from nose to alveoli, it will be very helpful to overcome those kind of problem. Jal Neti and Sutra Neti. So let's see what text explains and how we can interpret the text as a scientific view. So let's. Now let's understand what is Jal Neti and what is Sutra Neti and how to perform. Jal Neti is the kriya. We will use the water. We will be putting water in our right side first. Then will be that is thrown through the left nostrils. Again it will be opposite side. Drinking or the sucking the water through the left nostrils, and it will be releasing through right nostrils. By that what happen? The nasal blockage if you have, that will clean. This is the normal procedure of a Jal Neti. And Jal Neti must be followed by preparing some saline water, little bit warm water, and you need to make some salt. You need to mix some salt and you need to make it like saline. Then you need to suck that water. You can start with right side and left side, that is your choice. But as per yoga tradition, we believe right side is known as the Pingala and it's the activations. So by the starting through right side, water putting from right side, it will activate your body force and energy. And kriya are the very forceful technique, so that my maximum force will be there. So by that force, what happen? The cup will come out. That sense, we start our right side first. Then we do left side. So the saline water. And how to make the saline water, all these things you will be knowing. Okay. So Jal Neti, this is. And what about the Sutra Neti? Sutra is the practice by using some thread. Thread's length must be bitasti, from here to here, 9 inch. It should be here to here, it should be 9 inch in that sense. Okay, don't use rubber, use the actual thread. If you are able to make your by own, if you prepare your own, that is very good, cotton thread, then you need to put it at your right nostrils, then you need to rub it and you should remove it from your mouth. Same way, again other side, if you have to put it left side, then you have to rub it and you need to remove from your mouth. Okay, so this is the practice of the Sutra Neti kriya, Jal Neti and Sutra Neti. As per Hathayogapradipika says here, how to practice Sutra Neti. Mention here, Sutram bitasti shushnigdham nashanale praveshayat mukhat nirgametcha esha neti siddhai nigaddate. See, they what use neti. Neti means Sutra Neti in terms of this. What explain here? Sutram. Sutram means the thread should be bitasti. Bitasti means I already mentioned 9 inch from here to here. Okay. Susnigdham. It should not be very rough. It should be very easy to move. Susnigdham means like lubricant. The sutra should be lubricant. Sneha. Nashanale pravesha. You need to put or need to insert at where? Inside the nostril. They not mention right side or left side. You can start with any side. But in yoga, we believe we should start the energy increasing Pingala side, right side. So this practice will help to remove the excess phlegm and fat by stimulating the energy. And energy can be stimulated through right nostril. That's why we practice Surya Vedana Pranayama from right side. So Praveshayet. Mukhat Nirgametcha Esha. Then at the end, what you have to do? You need to remove it from Mukha, means mouth. This is called Neti Siddhai Nigaddati. This is called the Neti. Who mentioned? Siddhas. Siddhas means the scholar, the yogi, earlier yogi, they mentioned this is called as the Neti kriya, Sutra Neti kriya. Okay, simple process they explain. You can see the video anywhere, YouTube and anywhere I think you have seen. So the simple process they explain, putting the thread to the nostrils and removing from the right mouth by rubbing effect. Okay. Now what is the benefit? This is sloka related to benefit. So let's benefit explain here. Kapala shodhini, benefit number 1. Chaiba dibbadrishti pradayini, benefit number 2. Dibbadrishti. Dibbadrishti means divine visions, good visions, common word. Kapala shodhini means the skull area will get clean, skull area, whatever the things is there. We will be looking as per science, scientific view. And dibbadrishti, it will give the divine visions. Jatra urdha jata rogagham nitrasho nihanticha. Jatra urdha. Jatra means shoulders. Urdha means above. So above the shoulders, whatever the diseases are there, mainly ENT problem. ENT problem means ear, nose and throat related problems if you have, that can be rogadham. It will be killed. It will be removed out by the practice of netirashu. Niyanta means it will clean. It will remove it out. So what the benefit explain? 3 benefits as per text. Kapala shodhanam, 1, cleaning the skull area, purification of the skull area, divine vision, 2, and above the shoulder disease, 3 benefits. Okay. Now let's understand about the mechanism of particular kriyas. Particular kriya means Jal Neti and Sutra Neti. So before going to left side picture, let's understand this picture, the picture number this. What explains here? See, we have the 4 sinuses like frontal, sphenoid, ethmoid and maxillary sinuses are there. They call as the air-filled cavity. Always air will be fed into that. Easily it can flow. But sometimes what happen, due to some accumulations of the phlegm or watery content, mucus, it will be like swollen like this. If you see white kind of things, it will be like this. And you will feel kind of irritations and kind of heaviness over your skull area or over your near to your side of your nose or under your eyes, and it may create your headache, dizziness, all these things will be there. So this problem is called as the sinusitis. Okay, it is the the form of migraine. All these things comes under same category. So that things is here. This is called the abnormal sinuses. It will be fed by the phlegm, excess phlegm. Phlegm must be there. If it has become excess means then only problems start. Now how Jal Neti and Sutra Neti helps to remove this? This is the questions. For that purpose we need to understand this particular picture. Here see, the water will go from this side or sutra, whatever. It will go from this side, Jal Neti or Sutra Neti. It will go from nose, the nostrils. Then here what happened? You can see the superior nasal concha, you can see upper part, superior nasal concha and the inferior nasal concha, and this is the middle one. The work of this concha is called maintain the temperature actually, temperature management it will do. The here so many hair like projections will be there called as cilia or vestibules. They will filter the air. So the dust particle will not come to your nostrils. Automatically it gets filtered by the cilia. Now it will go to the next part of the nose, that is the concus, and concus works to maintain the temperature. If the temperature, external temperature, natural temperature is very hot, they will humidify the temperature and they send the cold temperature to the trachea. This is the main procedure. If the outside temperature is very heat, they will make it cold, automatic, natural AC. Then it will go to the cool water, it will go inside. By chance, these concus are filled with the phlegm. Okay, phlegm may be accumulations of the food, whatever the food particles you are eating, your habit to eat the more sweet items. Okay, so it can be fed. So the actual sensation of the concha cannot be felt. Okay, so their quality is called absorbing the quality. So that may not be there. So that purpose what happen? The things, the temperature should be absorbed by this concha, it cannot be done. So you will feel one kind of blockage in this particular area. So whatever you are smelling or you are getting some sensation, that may not reach to the particular brain cells, and it won't reach to the olfactory nerve. So smell purpose problem starts. Okay, so this thing happen. Now I am drawing this picture for your understanding purpose. See, this is one common nose. We are understanding. This is one common nose, like this one nose. Here what happened? This is called the situation is like this. Now here accumulations of the fat like this. It's like this. This side is perfect, okay, and this side is inflamed. Okay. Now this thing happen in sinusitis problem. So what happen? Water cannot go, and if you practice the Jal Neti and Shatkriya, the Jal Neti means it is the salty water. So it has one kind of osmotic pressure. Since salt water goes means the salt has the capacity to absorb the water. If you keep the salt on your table, after 1 hour, so many waters will be there. So it will absorb the salt from, it will absorb the water from the nature, from the atmosphere. Same way, if you pour the water here, saline water, the saline water will go there, and by the salt, what happen? The excess mucus are there here on this particular place. If you see the excess mucus are there here, that will be drained out from the nostrils. It may be from your mouth, may come sometimes. It may come from some other nostrils, opposite nostril, or may go to your sometimes your trachea or sometimes your digestive tract also, which is no issue, no problem. So that's how that here the blockage is there, that can be drained out. Dervish formations or the flame formation that is there, that can be come out easily. So what happened here in sinusitis problem? The excess flame are deposited here. So if you put the salty water from this nostrils, for example, you are putting salty water, so that will go and it will works on this, and salt has the capacity osmotic pressure. It will drag the, or it will absorb the watery content. Means here also kapha means watery content, phlegm means watery content. It will mix into water, means in the Jal Neti water, then it will come from your nostrils. So this way it will clean your blockage in your nasal patches and in your sinuses. This sense it will work on your sinusitis problem. Okay, here also same thing we have seen. Here the smell, here you will feel the olfactory nerve. We will be looking there, see olfactory bulb is there. Here olfactory nerves will be there. If there is no what you call conchus not working properly, then it will obstruct the air passage. Then only you cannot breathe properly, because the pure quality, the actual quality is nasal quality got lost. So here it will be stuck, and if you breathe means the breath will not come sufficiently. That's why we feel the some kind of breathlessness or the call shortage in the breathings. These problems can be seen here. So this is the one procedure under that. Now if you see the regarding the smell, this practice will help for the improve the smell also. See, water you are putting or sutra you are inserting from this side. If here blockage is there means this optic nerve cannot smell properly, and that message cannot reach to your brains, and brain cannot understand the what food it is. Maybe it is good tasteful food or not food. You cannot, the brain cells cannot absorb that or cannot collect that. So what happen? If you clean this place is very clean means automatically the sensation, whatever the things coming from this nose, it will be smelled by the optic nerve and it will go to the brain cells. Some person may get the smelllessness. For them this is very good practice. So they can go for this practice. So in that sense it will improve the smell also. Okay. Now come to this visions. It will good for vision also. They mention the Dibya Drishti, divine vision. So what happen if in normal, if you see the glaucoma. Glaucoma is called the excess fluid in the aqueous, what is called aqueous humor. So this, if you see this color, this is called the oxygenated aqueous humor liquid. This is deoxygenated. So this should go release from here and it will mix into blood vessel and it will go to out of your body by the process of urinations and all, or sweating anyhow. It will go. But what happen if there is a blockage? Something, it's the vessels are not clean, not pure. There is a blockage. The watery content, aqueous humor, the deoxygenated aqueous humor will be filtered here. It will be collected here, and it will be placed over your lens, and you cannot see properly. So that is called as the glaucoma problem. So different practices will be there to overcome the glaucoma problem, which is, after getting the old age, maybe 60 years, 55 years, the person not able to see. That's why they use the specs. Specs they use to see it properly, because their lens is not very good clear. That's why they use the lens number -2, -3, -4, because the watery content means the aqueous humor is collected here, which is not good. See, aqueous humors are two types are there. One is called O2 and CO2. CO2 is not good. So that should go out, and it is not happening in this particular case, glaucoma case. Now in this case, what happened? The near to the eye side, it will be lacrimal gland will be there. Lacrimal gland. So by the practice of Jal Neti and Sutra Neti, I think you have experienced during practice of Jal Neti and Sutra Neti, it gives the stimulus your optic nerve also. So that's why water may comes from your eyes also, tears comes. Okay. So what happened? It gives a sensation, stimulation to the eye cells or the eye nerve. By that what happened? The accumulated unwanted things or the aqueous fluid that will get stimulated and it will come down. In that sense, it will cure your glaucoma problem, and it says it will go good for the giving the Dibba Drishti, divine Drishti. So that sense they mention Dibba Drishti Pradayini, divine Drishti. Dibba Drishti means the person whose Drishti is not very good, vision is not good, he can overcome so many problems, even cataract also, like cloudy in lens area. So that problem can be overcome. So in this two view, it will improve for our smelling capacity as well as Drishti, visions capacity, by practice of Jal Neti and Sutra Neti. Let's see. Next is explain it will very good for the hearing problem also. Because see, the water will flow from this side, it will go this way. Water or the thread, it goes. Okay. And here, the ears is located. This is called the eustachian tube. Eustachian tube. That's why we do sometimes like this to balance the excess pressure of the sound or the force. Sometimes if the big decibel sound is there, you cannot tolerate. That's why you need to breathe, or sometimes you can open your mouth also. The person who died with the big sound, his mouth gets open because he is not able to tolerate the sound from to listen from his ears. So that's why eustachian tube is connected here. You can balance that excess pressure of the sound. So what happens if you put the water here, the cleaning will be there full this nostril part, and the nerves which is connected to this particular ears are called as the cochlea and the vestibular nerves, they will get stimulation. So any problem regarding the middle ear, remember middle ear problem regarding this middle ear here. So that here onwards it will start, goes like this, eustachian tube goes like this. So if you have any problem regarding the middle ear, this particular place, that can be overcome. Okay, but remember the person having the inner ear problem, means the cochlea and the what do you call vestibular organs, if they have in this particular problem or they have the problem regarding the inner ear, he should not practice this, because Jal Neti and Sutra is a very forceful practice. Even the salt water will be there, and that may not be very good for the practitioner who having this inner ear problem. So it may affect your problem also, ear problem also. So in that sense, he should not practice. Okay, so this is the story behind this. So in that sense, it will be helpful, because you know the three bones will be there: malleus, incus, and stapes. By the eardrum, the air will come from eardrum and it will hit this particular bones, and then will go to the cochlears. Next part, inner layer. So if there is a particular mechanism which can keep these bones clear, then only it will go very easily. So that's how we need to practice Jal Neti and Sutra Neti to clean our middle ear, not for inner ear. Remember. Okay. Yes. Now let's understand some benefits of this particular practices. Jal Neti and Sutra Neti. It's purify the scalaria. Scalaria means in this particular place. That's why they mention what Kapala Shodhanam. Any kind of impurities is there, that can be cleaned by the practice of Jal Neti and Sutra Neti. How Kapala Shodhanam will be there, we already mentioned here. See, these nerves are there. If you have any blockage, this is called Kapala, this level, which the brain is divided into four parts. This is called the frontal part. The frontal part level, if you have the any kind of impurities, that can be overcome by the stimulations, and the impurities can be in the form of the blockage of the nerves. So nerve roots will get blocked. So by the practice of this kriya, the skull area will be purified and clean. In that sense, they mention here, it will purify the skull area and overcome the sinusitis we already discussed, and helps in the vasodilation and improve the blood circulation. Vasodilation means the blood vessels will be there like this. If the salty water goes inside that, what will happen? The blood vessels will become little white. So dilation will take place. So easily the pressure is there in the blood, that will become less, decrease. But at the same time, if the person having the high BP, he should not practice. Okay, so blood circulation should be more. So the thickness will get increased. So blood can flow very easily. Helps in the diabetic retinopathy. Diabetic retinopathy means the backside of your eyes, the vessels will be pressed. So the proper flow will not be there of the blood. Okay, due to the excess form of the glucose in your body. We common in yogic term we call as the kapha. So that retinopathy can be done. If you practice, automatically the kapha will go out of your body. Now good practice for the glaucoma we already discussed, and cure the headache, because say the blood vessels are constricted means the blood will not reach, the oxygenated blood cannot reach to your brain cells. So oxygenated blood is not reaching means the cells will not work properly. So headache may feel, or epilepsy, dizziness, all these things can be overcome. Especially it is good for the ENT problems. Okay. And who should not practice? The public, the person who is suffering from the chronic bleeding in the nose, he should not practice. Nasal tumor having means should not practice. And the hypertensive people, the person under hypertension, he should not go for this. So these are the limitations we need to mention. Okay. Yes. Thank you. We'll meet in next class.